Hello, everyone, and welcome to another week of Got a Problem with Your Knee? Ask Dr. P. My name is Luciano Vigilati. I'm a VFit specialist here at Victory Motion, home of knee repair, not knee replacement. We are so excited to welcome you to our weekly show. We have a ton of questions that were submitted to our school group, Got a Problem with Your Knee? Ask Dr. P, our Facebook group, Knee Repair, Not Knee Replacement, and our social media accounts at Victory Motion 1. We got a nice theme going on today with our questions today. Today will be mostly about golfing and pickleball. So, ways of managing pain from pickleball, golfing, and ways of preventing injuries as well. First thing is first, though, who is Dr. P? Dr. P is a board certified orthopedic physician, a sports medicine specialist, and a regenerative specialist. He is the founder and CEO of Victory Motion and the creator of the trademark Knee Repair, Not Knee Replacement program. Victory Motion's mission is to make the world knee replacement free by 2043. Yes, you heard that right. Knee replacement free by 2043. Dr. P has over 25 years in orthopedics and regenerative medicine, so he brings a wealth of knowledge every week to the show to be able to answer your burning questions. So without further ado, let's welcome Dr. P.
I'm here, Lucci, and there you go.
Here we
Hi,
go.
how are you?
I'm good. How are
Hey,
you?
how's everybody doing?
So, like I was saying in the intro, we do have a nice theme going on today, and it will be about golfing and pickleball. So
Nice.
let's get right into it. The first question is, can I golf if I have a knee replacement?
Okay, so the first question is, can I golf if I have a knee replacement? And the answer is yes. A lot of people choose to undergo a knee replacement so that they can golf because they're having difficulty golfing. I guess the real question is, do you necessarily need a knee replacement if your knee is bothering you in order for you to golf? That's usually my first question. And most people we find don't need a knee replacement in order to get back golfing, even if they have a fair amount of arthritis. That would be my first question. I would ask that person.
Yeah, for sure. And yeah, we've definitely seen in the office times where people have been told that they need knee replacements and they can't come in to try and find a, less invasive way of getting back onto the course and things like that. So, what knee structures are most at risk during a golf swing?
Okay, so I guess the question is what knee structures are most at risk during a golf swing? And it depends on if you're a right-handed or a left-handed golfer. But let's just use the right-handed golfer. Sorry, all you left-handed golfers out there. So with a right-handed golfer, the left knee or the lead knee is going to have more stress than the knee in the back, the right knee. Even though the right knee does do some twisting, the heel lifts up off the ground, and so it's not as much torque or stress, whereas the left foot stays planted pretty much for the most part. And so there's a lot more strain on the outer side, the lateral side of the left knee, and there's a lot more rotational or torque force on the inner side. So a lot of people have arthritis in their knee where the cartilage on the end of the bone is wearing down, kind of like the tread on a tire, or they might have a meniscus tear, which is the shock absorber cartilage in between the thigh bone and the shin bone. Or they might have some soft spots in the bone, some stress or microfractures. When the cartilage wears down, more and more force gets transmitted to the bone, and then the bone can start to break down faster than the body can heal itself. So, with the golf swing, that rotational movement with the foot planted and compression and rotation load, especially on that inner side of the knee, can really cause those symptoms to flare up. But you can also have pain on the outer side of the knee as well because it's causing a kind of a stretch on that outer side of the knee. So those are the main structures that we see that get potentially injured or damaged or aggravated with a golf swing. And that actually brings up, I have a story about that. So, as you know, we had a golf pro named John, and he was told exactly what you just said. He was told he needed knee replacements on both sides. He was also 52 pounds overweight, or even more than that, probably because he had not been able to stay active because his knees were bothering him so much. And now he's a golf pro. He even thought about quitting golf. So I remember on him, we did work on having him lose the weight, and he did lose 52 pounds. But we worked on that lead leg. He's a right-handed golfer, and that left knee. actually didn't look as bad on the X-rays and on the MRI, but it hurt more. And it makes sense. That's the knee that was getting more stress on it. So we worked on that lead leg. You guys worked on the lead leg, and now obviously he's pounding the ball 300 yards down the center again, and teaching people, which is really what his passion is.
Yeah, no, and I got the privilege to work with John a little bit as well, and like, working on the strength around those surrounding muscles around the knee and really working on rotational exercises really helped. And then we simulated his golf swing to check on mechanics and things. And we do have a question coming up about golf swing mechanics and how that can lead to other problems. So I won't get too deep into that, but. Yeah, breaking down the swing, in our VFit sessions to really unload the knee as much as we can and, prevent overload on specific structures was key. But yeah, it was fun working with him and it's fun doing actual, things to get them back to what they like to do and simulating that. And we touched on it a little bit last week about the mental aspect of not being able to do what you love. And I think getting John back onto the course, what he loves to do, not only helped him physically, but it helped him mentally. So the next one we have is what shoulder structures are most at risk during a golf swing.
So, what shoulder structures are most at risk during a golf swing is the question. And again, that depends if it's a right or a left-handed golfer. So let's be fair to the left-handed golfers now. So with a left-handed golfer, I'm a right-handed golfer, but it would be the right shoulder or the lead shoulder that experiences more force. And with a right-handed golfer, it would be the left shoulder. Not that the other shoulder can't be bothered either. So if you're a right-handed golfer, that right shoulder can rotates inward as you're coming around. And if you have any pinching or impingement in the front or bursitis or inflammation, certainly that can be aggravated. But the left shoulder does the majority of the work with a right-handed golfer. So the rotator cuff, the long head biceps tendon, these muscles and tendons are working eccentrically. So in other words, you're whipping through, and now those muscles are trying to slow things down, just like when you throw a ball and they can get damaged because when muscles are lengthening and contracting at the same time to slow a structure down like the shoulder, that's when they tend to get injured. And now the labrum is also a rim of cartilage around the socket. So you have your ball, you have your socket, and there's a rim of cartilage around the socket that kind of acts like that thing on a plunger that gives it a little bit more suction. And the biceps tendon attaches up there as well. And so that structure can get, because of the rotational forces and the compressive forces and you have compressive forces, rotational forces, and you also have forces which, why am I choking on that word right now? Distract. So
Yep.
they tend to pull the joint apart and push it together and rotate. So all those maneuvers, pulling apart, pushing together, rotating, they all can lead to stress on all those structures, the labrum, the cartilage in the joint, the rotator cuff, which are the surrounding fine tuner muscles of the shoulder, the biceps tendon. And so those are all at risk. But I think by far, right, it's probably the rotator cuff and the bursa, the little bursal sac above it that lubricates it that can get inflamed. So you can get bursitis and you can get tendonitis. And we have a lot of golfers who, because they don't have good mobility in their thoracic spine, even in their lumbar spine, even their hips, even their knees, even their feet and their ankles, that can work its way all the way up the chain and cause excess stress on the shoulder because you're swinging more with an arm swing and not with a body swing. And that's what we see. And that's just like a pitcher, a thrower who doesn't use their lower body or their core, or they don't have good mobility in that upper spine, the thoracic spine, and they put too much stress on the shoulder. So with John, that golfer we were talking about, we were working on his knees, but we worked on everything from the top all the way to the bottom. He also lost weight, which helped a lot as well. But we basically worked on his whole, what we call kinetic chain, or you guys worked on it, total body, full body, to take the stress off of his knees, but also the stress off his shoulders, because those they weren't bothering him as much, but they were bothering him because he wasn't able to use his knees. So now he's putting more stress on his shoulders. And we knew he had back issues and, everything's connected. So working on the whole body is really important.
For sure. For sure. Next one, which we kind of touched on a little bit, but we'll, be more specific on it. Can poor swing mechanics lead to knee injuries?
Yes, poor swing mechanics can lead to knee injuries. And that is basically what we were just talking about. The whole body is connected, so it's a kinetic chain from the feet all the way up to the neck and the head. And uh, so can poor swing mechanics. Okay, well, the swing starts with the feet, and it really works all the way up even into the neck. So any area in that chain, the what's the weakest link causes causes a problem. So if there's even one weak link, whether it's the actual knee that's causing an issue with the swing, or if it's the ankle, or if it's the shoulder, or if it's the neck or the upper back, that's going to affect all the other areas. So the point is, I mean, you can have poor swing mechanics just because you don't swing well. But a lot of people have poor swing mechanics because their body won't let them swing in the appropriate way. And so what a golf pro can do is help you with your mechanics, just the general golf mechanics. But what you guys do, total body fitness experts and a good therapist, a good rehab specialist, total body fitness specialist can do is really make sure all links in that chain are strong and functioning the right way, and then that makes the mechanics of the golf swing better. So it is kind of a circle. What came first? Is it the links in the chain that are bad that's causing the poor mechanics, or is it the poor mechanics that are causing issues with the links in the chain? And it's both. It goes both ways. But a lot of people's swing is terrible because their body won't let them swing it in the appropriate way. So that's the part that people don't realize a lot of times. And that's where a golf pro usually isn't going to help you. But we work with golf pros all the time, including John, who needed our help. But we have other golf pros who are patients, and we work with them together to help their students function better mechanically from a biomechanical and a biologic standpoint, which is what we do. And then they work on the actual specific, golf specific mechanics. And they can't do a great job with those without us helping them with what we're working on. On the other hand, if we get the person perfect in their kinetic chain, which isn't always possible, it's usually not, right? But get them as best as possible, and then they don't follow the mechanics and the directions that the golf pro told them, that's not going to work either. So it goes both ways.
100%. That's kind of like I was saying earlier about, really breaking down swing, making sure you're getting all those little kinks out. That's something that we do here. I mean, I'm not personally a golf specialist in terms of the swing, but there are still ways of, offloading that knee and correcting things here and there to really make the most out of each swing that you have. And you were saying it was last question, you said something about like bursitis and things like that, how you can get that after prolonged periods. And we have noticed that, and using our MLS laser has really gotten great results with like the bursitis and tendonitis. And so utilizing that in the office as well has definitely helped, and it definitely helped John as well get back to the course. Um, and, there are a lot of patients that aren't able to come in as often to get the laser, but we have a handheld laser that also gets the same benefits, just takes a little longer, have to hold it there a little longer, but it still gets those same benefits. So there are definitely ways that we can help. Even if you can't come in 3 days a week to utilize our laser, we have other options as well. So that is
You bring
good.
up a big point there. So, the question is, I get this question all the time. And I just got it from Steve the other day. And he comes in and he's like, it's golf season. I'm in a golf league. My shoulders bother me. We did the whole comprehensive diagnostic evaluation clarity where we figured out that he has a little bit of partial tearing in his rotator cuff, has a little bit of bursitis in there, overuse stuff. Nothing that necessarily needs surgery, but it is limiting his ability to play golf. But this is golf season up here in the Northeast, and people don't want to undergo a procedure or a surgery and be out, miss the season, right? So, like you said, what things can we use to keep people going during the season? And then maybe if they need something after the season more in depth, we can do that. or sometimes we'll get them better and they won't need that, right? So I think, like you said, the total body fitness, working on all the links in the chain to make sure all those links are strong all the way from, and working right all the way from the feet up to the head and the neck. But also we need other help a lot of times. And the laser is an amazing thing. MLS laser, multi-wave lock system, two wavelengths of light. Just like light can help plants grow, that's called photosynthesis. Certain wavelengths of light can help our bodies heal and grow and decrease inflammation. And so the great thing about that is people don't have to stop golfing. They don't have to come out of their golf league that they paid for. They come in and they're treated 2 or 3 times a week, ideally 3 times, but it only takes about 20 minutes for a body part. And there's no needles, no shots, no side effects. It's very, very safe. And the laser decreases inflammation, increases blood flow, which helps healing, has a direct pain relieving effect. So you don't have to pop all those non-steroidal anti-inflammatory pills that rip your stomach apart or make your blood pressure go up. And then it also stimulates your mitochondria, which I'm sure you remember from high school biology, is kind of like the battery of your cells. It recharges your batteries so your cells work better. And that allows people to continue to play during the golf season and get better. And they can do their exercises, their stretches on the course. And then there are certain people, like you said, who are like, I'm going on a golf vacation. I can't come in for laser treatments, or I'm going, or I don't live near you, or I don't want to come in 2 or 3 days a week. That's where the handheld laser, and also we do a lot of telemedicine where they can do we've done where people are literally on the course and done a telemedicine with them and said, hey, do this, do that, do this, and it helps them get better. So we have the ability to do all those things. And I think you're absolutely right. Laser and total body fitness are a huge thing in season to get people through the season and not have to have procedures, whether it's needles or even surgery.
100%. And we all fall victim to it, pushing your body too much, knowing maybe you shouldn't be doing this, but you still do it because you just love it so much. So we all can relate to that. Um, But yeah, we were talking about the shoulder and stuff, poor mechanics, not getting that hip rotation. You'll follow through more with your shoulder, which can lead to that. And then, he said it's all a chain. So, that back's involved as well. So I do have a question relating to the back. Is it safe to golf if I have a herniated disc?
So the question is it safe to golf if I have a herniated disc? And that's a great question because I did have a herniated disc at one point in time. And there was no way I was golfing in the acute phase of that herniated disc. So most of the time, you're not even going to think about golfing if you have an acute, meaning a herniated disc that just recently happened and it's pressing on a nerve. Like you're not even thinking about golfing. You're thinking about, well, am I ever going to golf again? But you're in a lot of pain. Now, if we now people who have a history of a herniated disc, or maybe they have a herniated disc that's not pressing on a nerve and it's causing pain, those people we work with and we can help them to number one, if it's herniated currently but it's not pressing on a nerve, we can help increase the mobility of the spine above and below it. Because a lot of times that herniated disc is in the lumbar spine, the lower spine, and that upper spine, that thoracic spine, has terrible movement, and that causes there to be more torque and more stress on the lumbar spine. So if we can work on the hip mobility below it, and we work on the thoracic mobility above it, and any other issues in that chain, and correct all those links, many people can get by and get through and heal and still golf as long as they're not having severe symptoms, especially neurologic symptoms. Now, for the people who overcame and got better from the herniated disc, like myself, then you want to work on preventing that from ever happening again or aggravating that area that was damaged. Because once it's damaged, yeah, it gets better. But yeah, even if you did PRP or regenerative medicine like stem cells, which a lot of people do for spine, we don't do that on spine. We send people to. We do it for every other joint, including the knees, as you know. But even if you get all that done, or even if you have a surgery, there's always going to be some abnormality there. And so that's where we work on, again, the areas above and below it, not just the area itself, to take the stress off that area and to prevent that from happening again. So can you golf with a herniated disc when it's acute and severe and causing neurologic symptoms? No, that is not a good idea. Get in to see a specialist, a spine specialist, orthopedic surgeon, etc. If it is something that you've gotten over and you want to prevent it from being injured again, or it's not causing severe symptoms, especially no neurologic symptoms, then the answer is yes, we can absolutely work with that. And we do all the time. And we help people either stay golfing or get back to golfing in those situations.
Yeah, for sure. I think the biggest thing there was making sure like you're stabilizing that, making sure you're stabilized. It's not pressing on that nerve, it's not in the acute phase and you found your direction of preference and and you're on the trend up, then you could start, maybe even thinking about it. But like you said, once you're in that acute stage, you're probably not going to be even thinking about going to golf. It would be more, trying to just ease your pain as much as you can because those are pretty intense. Um, but yeah, coming in, seeing us, our VFit specialists, we really do a good job of, finding that direction of preference and getting you back onto that course. So the next question we have is, should I wear a knee brace while golfing?
So the next question is, should I wear a knee brace while golfing? And that brings up the patient I was talking about earlier, John, who is a golf pro, and we did the knee repair, not knee replacement on his knees. He also did the V Slim where he lost 52 pounds, which took a tremendous amount of pressure off the knees. And then he did the total body fitness where, basically from his feet all the way up to his neck, he was worked on, which helps take pressure off the knees, but all the other areas of the body. And so he used to like to wear knee sleeves. If you don't have instability, meaning your knees aren't, there's not a torn ligament that's causing true instability, then you probably don't need a brace. But John liked the brace initially because it gave him a feeling of some support and maybe some warmth and maybe some quote stability. But we all know the muscles are your main shock absorbers and your main stabilizers and the correct mechanics. And so and then also losing the weight, so you're not putting so much pressure. Once all that was done, didn't need the braces anymore. So the answer is, can you play with a brace? Yes. Do you want to rely on a brace? No, because then your muscles just get weaker. And frankly, I almost never recommend a brace for anybody because your muscles are your best brace. So let's work on those. And if you have a torn ligament like an anterior cruciate ligament tear and you chose not to have surgery and your knee gives out on you every once in a while, and that's true instability, then absolutely a brace is worth it because there is twisting and turning and pivoting during golf. So that's the only time I would probably, if there was actually a torn ligament and true instability, not just an ACL, but there's obviously four main ligaments around the knee.
100%. I feel like with a brace, a lot of times that gives patients that confidence, at least to start before as they go on. But I think really, trying to get out of the brace as soon as possible is definitely going to lead you to long-term success. The next one we have is how important is hip mobility and ankle mobility to reducing stress on the knees when
So
golfing?
how important is hip mobility and ankle mobility to reducing stress on the knees? And it's hugely important because you have that kinetic chain. You have that starts like each link, like the feet, the ankle's another link, the calf is another link, the knee is another link, the thigh is another link, the hip, etc. So, that chain is only as strong as its weakest link. And so if there is tightness or immobility or stiffness in the ankles, that is going to make there be increased stress above it on the knee and the hip for sure. And maybe even down further into the foot. Same thing with the hip. If the hips are tight, then you're going to have to make up for that with your knees. And that's going to put more torque on the knees. And so absolutely having tight or immobile or restricted hips and ankles can put increased stress on the knee. And that's why we work on the entire kinetic chain, strengthen each link so that you have as strong a chain as possible.
Definitely, definitely. And I was saying, with the hip, getting that rotation, and that's also for the shoulder as well. So you're not overcompensating with the shoulder. So, that hip mobility, ankle mobility, not just for the knee, also for the shoulder and that whole body, like you said, that link.
Yeah, so well, I'll give you an example. We have someone named Marcia. She had problems with her knees, underwent the knee repair, not knee replacement, or was in the program, had the injections in her knees, but you guys are working on her entire chain. She's a golfer, right? And you found issues with her hips and her back. And so by improving those, that takes the pressure off the knees. And now, she's back to golfing again. And if we had only concentrated on the knees, guess what? She would have the same thing would have just happened over and over again. Our goal is, yeah, we want to get your knees better, but we don't want that to ever flare back up again. And even though you might not have symptoms in your hips or your back, that may be causing issues with your knee and frankly your ankle as well, may be causing issues with your knee. So I really appreciate you guys always checking that out. And in her case, it got her back on the course, and that's what we're all about. And now we want to never see her come back in for shots ever again.
Right, that's the goal. That's the goal. Next one, this is going to be the last one for golf. Is it better to walk or use a cart when I golf if I have arthritis?
So the question is it better to walk or to use a cart if I have arthritis? And walking is a great exercise, just in general. It is impact loading, meaning you're putting some force on it, but it's not as much as running. And on a golf course, you have softer surfaces. On the other hand, you also have hills, and you have uh, uneven ground. So you're putting some different types of stresses on the knee, and you're also twisting and turning it during the actual golf swing itself. And you might be carrying or pulling or your bag, or you might have a remote control uh, thing for your bag cart. But in general, if the walking isn't bothering you, that's always better, right? But we also have people who either recovering from a surgery or an injury, or their arthritis is so flared up, but they're not going to stop. Then yeah, we don't want to flare it up more. So sometimes riding in a cart is better. Frankly, nowadays, because some of these golf courses are so crowded, they almost force you to ride in a cart, which is a shame because if you're going to golf, you're not really getting a ton of exercise unless you actually walk. So walking, if you can, is always better. But sometimes out of necessity or being forced to, you have to use a cart, which isn't, not quite as good. Having said that, the social aspect of it, you get a little bit of exercise if you use a cart, not a ton, but there's a social, mental, there's being outdoors, being in the sunlight, vitamin D. There's a lot of other positive benefits to golf, even if you don't walk or can't walk. So that's why if somebody can't walk and we're working on getting them to walk or kind of getting them to recover, but they really, really want to get out there, yeah, get in the car. It's going to help you mentally. It's going to help you socially, which we know people who are social live longer. Being out in the sun, getting fresh air, all those things help people's overall health because we're not just about physical health, we're about overall health, including mental health and longevity, and all those other things help with longevity and health as well. And we know our mental controls our physical. So even being able to get out there and golf, if you're not getting as much exercise using a cart, it's still going to be beneficial.
Definitely. And I feel like understanding like where you are, and knowing your body and listening to your body is a big thing too. If you walk less than a mile, if you can't walk over a mile, then you go play 18 holes. You can be more strategic about it. You can kind of balance it. You can bring the cart but not drive the cart right up to your ball, stay a little bit away so you're still getting that walking, but you're being more strategic about it and not overdoing it. So I think that's a big part. And, coming in to see us, we can see where you're at. We can see what your tolerance is and, build up from there. So that's important as
And
well.
all that, it's rehab, it's total body fitness, it's strength and conditioning, but it's also coaching. I mean, you need kind of a coach, and you need coaches help you titrate, your activities. And I love what you just talked about there. Park a little further away, increase slowly increase the amount of walking you're doing to the point where you can tolerate a full round of walking. Maybe just walk 9 holes and use the cart for the other 9. I totally agree. It doesn't have to be an all or none, and it shouldn't be an all or none. Even
Right.
just parking at, oh, using the cart path only and always walking to your ball is better than just driving up to your ball directly. So totally agree. Great point.
For sure. And like you were saying, I lost my thought there.
Sorry.
Jeez. All right. Well, if I think about it again, I'll come back to it. But the next one is we are moving on from golf and we're going to go into pickleball. Is
Nice.
it safe to play pickleball if I have arthritis?
That's a pretty general question. Is it safe to play pickleball if I have arthritis? Now it depends on where the arthritis is. But with pickleball, shoulders can be an issue because right, any racket sport, knees we see all the time, and so we just think of two people right off the bat. Larry had a shoulder issue, rotator cuff issue, came in. He was in season. He's not going to come out. He had an MRI done, and we evaluated him, and he had some overuse injury, bursitis, tendonitis. Itis means inflammation. And some stretching or partial tearing of his rotator cuff. Not enough to need surgery, but he would have really benefited from probably overall from PRP and bone marrow aspirate cells and all that. But he was not coming out. So he had laser, he had total body fitness, got him back. And I remember you guys even he'd bring all his equipment in and either play against you guys in the clinic once he was getting to that stage for functional rehab or do wall ball. And you guys really worked on his mechanics as well. And obviously, there's rotation. So same thing. Worked on the thoracic spine, worked on the lumbar spine, worked on the core, worked on the hips, worked on the knees, worked on the ankles, even though it was shoulder, right? And then the same thing. We have Bill. He comes in. It's his knees. And so he undergoes the knee repair, not knee replacement program, and he's doing the total body fitness with y'all. But you worked on his back, you worked on his thoracic spine, you worked on his upper body so it doesn't put too much stress on his lower body. He had tight Achilles. So once you guys got that all straightened out, he got back doing everything he wanted to do. Yes, we took care of kind of the root problem in the knees, but again, that root problem might be being caused by other links of the chain that are weak, like bad hip mobility or bad, uh, mobility of the spine, all kinds of things like that. So I guess the point is it safe to play pickleball? You need, you need coaching and you need the proper, therapy. So that's kind of not to toot our own horn, but that's what we specialize in. So especially you over in the VFit, you guys are able to titrate their exercise up, to the point where we make it safe because both of them have arthritis. Larry was suffering more from the acute part, the bursitis and the tendonitis, but he also had arthritis as well. So, can you play with arthritis? Yes. But the answer is in the appropriate circumstances and with the appropriate supervision and advice and coaching.
Yes, and that actually sparked what I was going to say last question. So, and I can relate it to this one because, it's the same for both golfing and for pickleball, and it's that coaching. You know, I say it all the time. Professional athletes ha still have trainers for a reason, and it's more than just progressing them and, adding weight. It's to protect them from themselves, Like I was saying, you want to do what you want to do, and you believe that you can do as much as, you believe that you can do it. So you're going to do it. But I think having that coach to protect you from yourself and really build you up and find that threshold of where you should be and when you should stop and how long, all those kind of things play a big role in progressing you to prolonged, uh, pain-free activity. So,
That's such a good point. I don't think we emphasize that enough. Like you said, professional athletes have trainers and coaches for a reason, and they're the best. They're the best in the world, and they still have it. So if they have it, how much more do we need it,
yeah,
right? And I think that's just such a great point. And I don't even, even though I was mentioning coaching and stuff, I don't think we let patients know enough that they are getting coaching as well. And it's so important, like you said. And frankly, I mean, even, people have business coaches, right? People have all kinds of different life coaches. They have all kinds of different coaches. It's really important to have coaches in your life. It really is, even for your business. So I totally agree with you. Great way of thinking about it.
Yeah. What what knee structures are most at risk during pickleball?
Okay, so what knee structures are most at risk during pickleball? And since pickleball is kind of a cutting, running, pivoting, planting sport, it's the same structures that are prone to injury with any running, cutting, pivoting sport. So the meniscus cartilage in between the two bones, which is the shock absorber cartilage, that is the type of cartilage that usually gets torn when you hear about an athlete tearing the cartilage in their knee and need to have arthroscopic surgery. So the meniscus is definitely one. Any of the ligaments, there's four ligaments around the knee. Probably still the MCL, the one along the inner side, is probably the most common one. But we do see ACL tears because it's a cutting, pivoting sport. The surface isn't quite as grippy as a artificial turf field for soccer or football, so we don't see as many ACL injuries, but you still see them because we have Lou, who she tore her ACL playing pickleball, and we did a bare bridge enhanced ACL restoration surgery on her where we regrow the ACL. And she's doing amazing because of all the work that you guys have done with her. But we definitely see that. So you have meniscus, you have ligaments, which is a sprain. You can have strains and overuse injuries. We see this a lot as well. Tendonitis, patellar tendonitis, kneecap tendonitis, quadriceps tendonitis, where the quad tendon is attached to the kneecap. We see a lot of that because the knee's bent a lot of times and there's a lot of stopping quickly. We see a lot of anterior knee pain, pain in the front of the knee, where that kneecap area and all the areas surrounding the kneecap structures can get inflamed. And so overuse injuries we see a lot. Itis means inflammation. Osis means degeneration. So tendonitis or tendinosis, we see a lot of that. We see muscle strains or sprains. We see hamstring strains. We see quadriceps muscle strains. So the hamstrings on the back, the quadriceps on the front. And so I mean, you're not necessarily causing arthritis by playing, but if you have arthritis, we see flare-ups of arthritis sometimes. And sometimes that's because the muscles aren't strong enough. The person's a bit overweight. The person's doing, people, once they start liking pickleball, man, they love it and they're fanatic about it and they overdo it. So overuse, I have to say, probably, what would you say? Because you see a lot of this as well. But I think overuse is the number one thing we see.
Definitely.
Wow.
I think it's that overuse, but I also think that that pivoting as well is where, you can see a lot of that. But that comes from overuse because the muscles are fatigued, they're not supporting the joint as much. So I think it does all come back to that, all stems back to the overuse. Um, yeah, I do.
So I have a question, and I don't know if
Hmm.
anybody asked this question, but really, I mean, ideally, if someone hasn't played a sport in a while or they're playing a brand new sport, they should get medical advice or professional advice. So imagine that, someone wants to start pickleball, and we say, hey, we'll get you in for an evaluation. It's going to take a couple hours. We're going to evaluate you from head to toe and we're going to work on these areas of your, again, we're called a kinetic chain, and obviously the chain strength is dependent on its weakest link. So if the knees are the weakest link, other areas can break down as well, and you can get shoulder problems, right? But if you don't have any issues and there's a bunch of weak links, and we can strengthen those weak links and we can fix them up, you're a lot less likely to get injured in the first place. So said people might come in and say, "Oh, I don't want to hurt my knee. What should I do?" Well, believe it or not, a lot of times we're going to work on your hip, we're going to work on your spine, we're going to work on your ankle, not even really work on your knee sometimes, because to prevent your knee injury, we need to work on some other areas. And so, really, I personally think, and this goes with our mission of being knee replacement free by the year 2043. I don't think there's enough prevention and proactiveness. I know we're working on that, and we have worked on that. We have preventive programs to prevent ACL injuries, which can lessen the risk of an ACL tear by 50 to 75%. But we will be working more on this, so stay tuned, everybody. There's going to be a lot more push for this. It's not as sexy. It's not as easy to convince people to prevent stuff, But once they get injured, then they wish they prevented it. So we need to work a lot harder on that. And even us who, we're all about being proactive. We probably still are just scratching the tip of the iceberg, need to continue to work harder at this.
100%. Always a work in progress. There's always more to improve, and I think we do that every day, which is going to continue us closer to that mark of knee replacement free. The next one we have, which you kind of talked about, getting back into it. So, how long will it take for me to get back to playing pickleball after a knee replacement?
Question that the person asked was, how long will it take me to get back playing pickleball after a knee replacement? Um, well, if the person hasn't had the knee replacement yet, I would always say, hey, maybe there's a way we can prevent you from needing the knee replacement, and then we can get you back quicker because we know that for sure. And most of the time, we can get people back quicker. And we know 25 to 30% of knee replacements are unnecessary. And we know that from studies. We know that it's probably even higher than that, but we know specific studies were done on this and showed that. Now, if the person has had a knee replacement or they are absolutely going to get a knee replacement, how long will it take to get back playing pickleball? And I would say, just like any cutting premium sport after a knee replacement, it's probably bare minimum of 3 months, but probably closer to 3 to 6 months to get back playing pickleball. That doesn't mean you couldn't start some ground strokes sooner or wall ball. That doesn't mean you can't work on your upper body. That doesn't mean you can't work on certain things. And that doesn't mean you can't even, you can even work on volleying back and forth and things like that earlier. But it's going to take to get back full duty pickleball, full go, 3 to 6 months after a knee replacement. That's about average. Obviously, there's exceptions. That's why we call it a bell-shaped curve. Most people are 3 to 6 months. Some people might take longer. Some people might take less.
Definitely. And I think the big point there is really, weighing your options and understanding that knee replacement isn't your only option. And, getting second opinions and making sure that before you make that life-changing decision that you've weighed all of your options. Because, like you said, doing more of a regenerative program like we do, we can really get you back sooner and keep your parts, keep you organic and
I mean, let's
take
use
keep you
this
that
as an
metal.
example. We talked about Bill, right? He came in, he was told he needed knee replacements. We got him back playing pickleball in less than 12 weeks. Whereas with a knee replacement, there's no way he would have been back full go in less than 12 weeks. It's very rare. And so using minimally invasive regenerative medicine techniques and total body fitness and laser and all these things that we do, and people want to say, oh, you're just spouting out about yourself. Well, yeah, we're proud of what we do because we get people better without doing a knee replacement most of the time. And most people want that. They're just not told that. Like you said, there's three options. They're told there's two options. One, you need a knee replacement. And two, if you don't want the knee replacement, then just suck it up. But we do programs called knee repair, not knee replacement, where that is a third option. And it might not always be what you choose, or you might not qualify. We have to, put you through a battery of what we call our clarity day to figure out if you're really, if there's clarity that you really are a candidate. But most people are, and we're able to get people better faster with regenerative medicine techniques than we are with huge surgery techniques like a knee replacement.
Right. And I think even just like the whole picture, the whole program, it's more than just injections, it's more than just V-Fit, it's more than just laser, it's all of it combined. So a lot of times when people hear about PRP injections and bone marrow injections, sometimes people don't get as great of results with them, but we do it a little different here, and it's more than just injections. We put the whole picture together, and I believe that's a big reason why our results are what they are, which is important. The next one we have is what are signs that I overdid my knee pain after playing pickleball? So what kind of things can I see or feel in my knee?
So, what are signs or symptoms in my knee if I overdid it playing pickleball? And this goes, by the way, for doing anything, but regarding pickleball, yeah. Um, quote unquote normal soreness, it usually might, if you overdid it a little bit, might last 2 or 3 days, okay, on average. And it should get better over those 2 or 3 days. It shouldn't get worse. And so that's kind of a sign. If it's like 2 or 3 days or long, if it's longer than 2 or 3 days, and it's getting worse, then you overdid it and something you might need to get checked out, see a professional, medical professional. If there is, you might get a little swelling, let alone in the knee, some fluid buildup within the knee, maybe some fluid buildup in front of the knee or on one of the sides of the knee. So fluid buildup in the knee is called an effusion. Your knee gets inflamed, just like if your eyes get inflamed, it produces more fluid. But same thing. That shouldn't last more than a couple, 3 days. To me, once you start getting fluid in the knee, that is a little bit more of a sign of overdoing it, even if it's not even 2 or 3 days. But in general, you might notice a little swelling, especially if you have some underlying arthritis. And it should, again, that should get better with ice and range of motion and exercises and maybe riding a bike to help get that swelling out of there. There's other things that can be done, obviously. But again, 2 or 3 days and that swelling's not getting better or it's getting worse. Yeah, you overdid it. You need to probably get checked out. Now, kind of worse injuries might be whether you felt it pop or not. Now all of a sudden your knee is clicking and snapping and popping and locking. If your knee's locking up, that's not going to probably get better in 2 or 3 days. And when I mean locking, it's stuck in a bent position. You got to shake it free to kind of release it, or you can't shake it free and it's locked and you can't get it straight. Then you should get in to see somebody. Um, if whether or not you felt a pop as well. Because I mean, some people have had old ACL injuries that they don't even remember they had, or they never even knew they had from when they were a kid. Now they start playing pickleball where they're cutting and pivoting, and their knee starts giving out on them. True instability. And then maybe it gets worse because you flared it up, and now just normal walking, your knee is buckling on you. You're just walking straight ahead, and boom, your knee gives out. That's not normal. Now you can have pain and your knee might buckle on you. So there's a distinction. If someone's walking and they get a little twinge of pain and their knee kind of flexes or bends and it buckles, that's usually not instability. That's probably still overuse, like a tendonitis or something like that. But if you're just walking straight ahead and there's no pain and you turn to the left or turn to the right and your knee buckles on you, that's probably true instability and that needs to get checked out as well. I've been talking here for a while. What other things can you think of? Because there's a million things that can happen, but again, most commonly overuse.
For sure. And I think that we have a good patient story with this one yesterday. And you were saying that it's mostly this is all for all joints. So it's not just the knee, but these are signs for all the joints. We had a baseball player that had injections into his elbow and we were working with him and we just started getting into isotonics. So we started with isometrics. We were working in isometrics and now we're at the point where we can start isotonics, concentric
Just
movements.
explain those two types of exercises just really quick too, to the
Yeah,
people
so
on the phone.
isometric is, you're flexing the muscle without movement. So it's staying in one place. So we have them up against the wall, pushing into the wall. So you're squeezing that tricep without movement. It's more safe for that muscle and where that muscle attaches. And then isotonic is when you're starting to get movement in there. So there's eccentric and there's concentric. Um, Concentric's when that muscle's shortening when you're contracting it, and then eccentric is controlling it as it's lengthening. Eccentric has a little more, puts a little more
Stress.
pressure on the joints and
Yeah.
on the tendons. But overall, we were getting back into those isotonics with our baseball player, and he did notice more increase of pain. He did notice some pain, some soreness, some joint soreness. It was a little tender to the touch after. Um, but getting back into those things, starting to get into those isotonics again, that joint and those bones and those tendons, they're not adapt to those movements again and or that stress. So it does make a little sense that it's a little sore. But we stopped, went back to a little isometrics, and it got better. So like you were saying, that 2 to 3 days, if it's lingering for 2 to 3 days, like we told him to monitor your symptoms for the next 48, 72 hours, make sure it is getting better. But there is an expectation when you're getting back into things to feel a little soreness, especially in the muscles and even in the joint. But it's really, like you were saying, making sure that it's getting better as time goes on and making sure it's not getting worse, but definitely the swelling as well. That usually shows you maybe did a little too much, but that's where my head goes.
Excellent. Thank you.
Yeah. The next one is somewhat similar, but it's now while you're playing. What are signs that I should stop playing? I'm in the middle of a
And
game.
so
When
I'm
should I
playing
stop?
pickleball. What are signs I should stop playing? Man, I mean, severe pain. It's not even going away. It's not like like I'll use an ankle for instance. You quickly roll your ankle and you have a sharp pain. It hurts like crazy, and then you kind of walk it off, and you don't really have much pain, and you keep playing. Like, is that always the best thing to do? Maybe not, but still, that's the pain went away, right? So if you get a sharp pain in the knee and or whatever, any pain, and it's just not going away, then you probably shouldn't keep playing through it, especially if it's getting worse. If your knee is locking, meaning it's getting stuck in a bent position, you got to shake it to get it free. Maybe there's something loose floating around there. Maybe there's a torn meniscus cartilage. You probably should stop playing. If your knee is constantly buckling every time you turn or pivot, maybe you have a torn ligament, especially the ACL. Other than being annoying that gives out on you and buckles and it's unstable, you could be doing more damage to the cartilage in between the bones. A lot of people who tear their ACL, they don't have a meniscus tear to start with, but every time that knee gives out, and over time, they start getting more and more meniscus tears, and that's your shock absorber cartilage. And you don't want that to tear because we don't know how to grow that back or replace that. We know how to repair it if it's repairable. A lot of times it's not repairable. So you don't want to tear that. Once you tear that ACL, stop doing cutting and pivoting activities, get it treated so you don't tear up the knee worse, especially the meniscus cartilage. If your knee is just blowing up and swelling during that match and it's just getting bigger and bigger, then definitely if you fall and cut yourself and you're bleeding a lot, there's a risk of infection. And speaking of which, if it's red or swollen or hot, maybe there is an infection in there. Maybe you scraped it playing diving and you have some court pizza on your knee and a big scab there, and maybe there's an infection going on in there, and you got redness, you got drainage like pus, you got swelling, it smells bad, whatever. I mean, stop playing. You don't want that infection to get worse. The more you play and the more stress you put on it, the more that infection can spread. Um, so if you're playing and any of those things are going on, I would stop and seek
Definitely.
attention.
Yes, I think the biggest things there is if you notice like a popping or anything like that, I think, if there was a mechanism of an actual like injury, I think that's a big sign to, maybe stop. But
Yeah, I mean, you
also
feel a pop. It can be your hamstring. It can be your quad tendon. It can be your patellar tendon. It can be your ACL. It can be your MCL. It can be a meniscus. You feel a pop and you have pain and it's not getting better pretty darn quick. Like when you roll your ankle real quick and it hurts for a few seconds and then it gets better. If that's not happening, then you should not keep playing. You're going to make it worse. Like a hamstring strain for that example, right? You injure it and the muscle just tears a little bit. If you keep going, it's going to spread apart and we can't sew muscle back together. We can inject PRP and bone marrow and things like that in between there to get it to heal. But once that gap gets too wide, there's not even surgery that can sew the muscle back together because it's like hamburger. So a tendon tear we can sew back together even if it retracts a long way. A muscle you can't. So I'm just going to pay through this muscle strain. I just pulled a muscle. You may make it to the point where it's not fixable and you'll always have a problem and always have weakness down the road, no matter what we do. I mean, that happens. We see that.
right. Yeah, those hamstrings aren't anything to play with. But we do it in VFit a lot, getting people back to it. And I like to use like a red light, yellow light, green light thing. So while you're playing, especially when you're getting back into it, is using that red light, yellow light, green light. So a green light is, you have 0 to 3 out of 10 pain. It's a little naggy, but it's, once you stop, it goes away. It's not getting worse as you go. That's usually a green light that you're good to keep going. Um, Yellow light would be, anywhere from 4 to 6 out of 10 pain. And usually that means to monitor what you're doing. Maybe take a break. If you're weightlifting, maybe go lower in weight, decrease your volume, things like that. Adjust something to your parameters. And then red light would be 7 to 10 out of 10 pain. That usually means to just stop what you're doing, monitor, see if you can figure out what was going wrong. But and then, like you said, if there's increased swelling, redness, bruising, things like that, then that's probably a sign to stop.
So like on the live broadcast here, obviously we can't put that graphic up. Someday we'll have a producer who put that graphic up for us. But for all those you who are watching this, we will do a replay. We also split this. So we do the whole thing and we split it up into little segments. So for this segment, he'll put in that's an awesome red light, green light, yellow light, chart to put in, not only as B-roll, but also in the description. So we'll include that in there for you because that's tremendous. And
Okay.
obviously, consult your own doctor. We're not giving medical advice. We're just giving guidelines in education. This is what this is. I get a lot of people on social media who ask me, what should I do for this and what should I do for that for their own specific self? We can't do that. You don't want to do that anyway because it's not good medical care. You would need to come in, be evaluated. Yes, we can do telemedicine sometimes, but just doing it over social media, no. Just giving guidelines like Lucci's giving, that's not medical advice. That's just common sense. So if you want actual medical advice, you can go to www.krinkr.com, www.krinkr.com. If you want more personalized education, or you can just call our office 315-685-7544. Yes, it's kind of a plug, but really it's more this is education. And if you really truly want medical advice, then we obviously have to see you. Or you have to see somebody else. As long as you see somebody, but don't ever, no matter who you're watching, whether it's us or anybody else, don't just take that as medical advice. Always go to the doc you trust, know, like, and trust the most. And if it turns out to be us, that's great. But even if it isn't, you're on the other side of the world, see somebody. Don't just treat yourself over social media.
Yeah, everybody's different and everybody, has their own story. So I think, filling in those gaps of the story are important to, a happy ending. All right. Doc, thank you so much for answering those questions, and thank you to all of our fans out there on social media for submitting them. If you have a question you would like Dr. P to answer, be sure to join our Skool group linked in the description below. As the date of this recording, it is free to join. Be sure to follow us on social media at Victory in Motion 1, and be sure to follow Dr. P on social media at Dr. Marc Pietropaoli, and that's Mark with a C. We will see you again on Ask Dr. P next Wednesday at 9 a.m. Thank you, Doc.
Appreciate it. Thanks, everybody.
We'll see you guys next week.